Hello, all right, we're ready. We're on Facebook Live. I'm Dr. Montalvo, bariatric surgeon of Mexico Bariatric Center. It's a pleasure to be with all of you. So we're going to start with our session of Q&As. If you're ready, we can talk to start about all our weight loss procedures, or everything what you want to know about the pre-op diet, the post-op recovery. Okay, so patients are connecting with us. All right, about the procedures that we offer, we have a lot of procedures, maybe all of them. It came from the gastric balloon, the gastric sleeve, bypass, mini bypass, duodenal switch, revisions from any kind, since the lap band revisions to BSG, lap band to RMY, sleeve to bypass, cholecystectomy, hiatal hernias, any kind of procedures. Other questions here is, what medications do you need after surgery? Well, most of the patients only need antibiotics and analgesics, and sometimes very small patients takes medication for the nausea. How long does the gastric sleeve surgery take? Well, it depends. Most of the patients will take like 45 minutes. It's a fast procedure. Since you get into the OR, then you get out, it will take like 1 hour. All right, since you get under anesthesia, then and you wake up. Okay, another here is there a limit on how much cups we can have in a day, considering how high sodium they have? Well, you can take all the cubes that you want, all right, the ice cube. That's more to be your mouth keep hydrated, and don't worry about how many cubes that you take. That's free, that all that you want. We can give you all the cubes that you need. How long will it take to recover after surgery? This will depend what kind of activity you do. If you're at an office or sitting on a computer, or you don't need to lift anything, it will take from 1 week. But sometimes people have or the work is very heavy, or truck drivers, we recommend more time for that kind of patients. It will take from 2 weeks to 4 weeks. And the other thing is what kind of the procedure they have. If it was a gastric sleeve and a bypass RMY, with 7 to 10 days. But if it was a revision surgery, was a revision of RMY, or it was the other kind of surgeries, it will take more time. All right. Okay, one patient here asked about they hate to make some exercise. Will that affect the weight loss after surgery? Yes, because the surgery is only like a tool. You to this have 100 of success, you will need to take the first step is to take your surgery. After that is to follow up a good nutrition plan, and the other percent will be to make some kind of exercise. We're not talking about to run in a marathon or to be all the day at the gym. Only 30 minutes walking, or if you go for an exercise plan will be better, okay? But after surgery, this is not magic, but it's only a work tool for your weight loss success. Other question here is, I have type 2 diabetes. Which operation is best for me? Okay, if you make some research about the procedures, all these weight loss procedures are bariatric and metabolic procedures. It means these kind of procedures will help you on weight loss, the most important, and obviously, consequently, will if you suffer from diabetes, hypertension, cholesterol, fatty liver, arthritis, heart conditions, this will help you most in like 95% of the patients. Some of the 95% of these patients will need more pills in the future, or some patients who use CPAP will not need it anymore. How do I prevent dehydration? Is another question. The first 7 days is very important to be very good hydrated, because this is the only diet that you will have. So all day, once you have your surgery, all day you need to be with your bottle of water or electrolytes, Gatorade, all the liquids that you can take. All right. That's how you're going to prevent dehydration, because it's one of the most common causes to go to the ER. Let's read about another question here. If a patient is taking blood thinners, how many days before the surgery have to stop them? Or if we prescribe another type of blood thinners, it will depend on what kind of blood thinners that you take. So that's why it's very important to put all the information on your HQ. So most of the patients, we recommend to stop them 7 days before the surgery. And most of the patients take aspirin. The aspirin is very important to stop it, all right? Because this is to prevent if you have some problems with your blood clots or your bleedings. This is to prevent some bleedings after surgery. So when the patient is taking another kind of blood thinners, we make the switch for other kind of blood thinners for another 3-4 days, and then you need to stop them. And don't worry about when you're going to start, because when we finish the surgery, immediately after we finish, we put a blood thinner so you can continue with your program. All right. Is being anemic dangerous for general anesthesia? Yes. It's not like dangerous, but there's a limit of your hemoglobin to go into the OR. The limit is 10 of hemoglobin, and the normal is between 12 and 40 to you can go in. But if you have less of 10, it is very important to sometimes with iron and some extreme cases, blood transfusion, but it's very rare. Okay, another question is, how much weight can I expect to lose after gastric sleeve? The weight loss in gastric sleeve or RNY or on mini bypass, in all that is the same, all right? They expect in the first month or months is between 20 and 30 pounds. This will be in the first 18 months. After that, you can continue losing weight, but like I already explained, it's very important to continue a nutrition plan and some kind of exercise. Because if you don't follow these rules, you will be, your weight loss is going to be very slow, or sometimes you can gain some weight because you're not going to eat the calories that you need. You're going to eat more calories. So that's why it's very important to continue with a nutrition plan. Okay, another question is, how will my blood pressure medicine affect me after surgery? Is a diuretic. After surgery, it's very important to, if you're diabetic or hypertension, to be under control. If you check it by yourself, continue do this, because sometimes in the first days there are going to be some changes, and some we recommend to the patient to not to take your pills for blood pressure or diabetes, because you can fall into low blood pressure or low blood sugar. When do I stop antiseptic shot before surgery? All right, the antiseptic. One moment. Antiseptic is antiseptic. All right. Okay. I think it's for the sugar, right? That kind of med. Well, this kind of med, you can take it. Okay, you can take it. But obviously, previous take how many glucose you have. All right, if you're under 100, don't stop it, because you can get under your glucose very low. But if you're over 100, you need to take it. Before the surgery, the surgeon or his team will contact the patient to give specific instructions, or this is something the patient's coordinator will do. Okay, we're a team. We are in this. If you need to contact the doctor, we will contact you, and or if it's general information the coordinator can do, but we always know about what our condition of our patient have, or if we need to take a specific condition. So that's why it's very important to our patients put all their information, your medical information, on their HQ, so we can make some recommendations, or just to be informed of what we're going to make on their surgery. Is it worth lifting weights if you're not getting enough calories? Surgery on July 23. Okay, lifting weights if you're not getting enough calories. Well, your surgery was very recent. It was Octubre, Julio, Agosto, Septiembre. It's 2 months. So if you don't believe it, you're still on recovery. Okay, you're on the first 8 or 10 weeks. So you're still getting out of your surgery. So for lifting, you can start. You will know your body. Okay, you know your body, and you know this is more important on the first week. This is to prevent that you can fall or hit your tummy and get some interbleeding or you to feel bad. But right now, after 10 weeks, you can do your normal activities and you can start lifting, okay? But be careful. Be careful because you're going to start and it's not the same force, all right? Do you have a lot of married couples get surgery together? Yes, we have a lot of married couples because they come together and they take care of each other. So yeah, we love to have that kind of patients. Another surgery is, why does gas pain happen after surgery? Okay, the gas pain is not in all patients. It's not like pain. It's more like discomfort. This is because we put the gas inside your tummy, so inside everything, your abdominal cavity expand. Okay, when we finish all that gas, we take out all that gas. But sometimes, or most of the cases, is a small percent inside. And what happened with that gas? That gas obviously go up. And what are the symptoms? The symptoms is that you can have some shoulder discomfort, you can have a little bloating, but every hour will be better. Every hour will be better. As soon as you start walking and feel better, the symptoms go away. How long does it take for your inside stomach to heal after the gastric sleeve? Okay, well, after the sleeve, the day after, you're going to start with your liquid diet. Okay, so and like in 4 or 6 weeks, you're going to eat normally. So the healing of the surgery is immediately, okay? Because right now, remember, we make 3 leak tests, and we put some staples and suture the staple line, all right? And this prevent to have some kind of complication. The rate of complications is less of 1%. Approximately is between the 0.3 and 0.5%. Okay, so it's very, very slow. So low, sorry. And to healing, it's immediately. Right now we get in what kind of heal, all right, to heal. So if we're talking about to eat or eating, it will be in 4 weeks. But to take liquids, it's immediately after the day after. Another question is, can weight loss surgery help me with live longer? Of course. We're talking about the studies talk about 10 years. 10 years of more live, all right, more love. So if you want to be 10 years more with your kids or with your granddaughter or grandson, most of the patients take this decision because they want to be more time with your granddaughter or your grandson, and then 10 years is great. Okay, the lowest BMI to be candidate. All right, the lowest BMI is 30. All right, because under 30 is we go, or we're talking about overweight. Over 30, we're talking about obese. So right, so you can be a candidate for gastric or weight loss surgery. You need to be over 30. The surgery, what surgery we recommend for revision for sleep? Okay, well, we recommend the bypass. Okay, so you already have your sleep. We need to know, what do you want the revision. First of all, you gain more weight. You're having severe reflux. What do you expect, or what do you want, or what do you want your revision? It's very important. But most of the patients that have the gastric sleeve, we make a revision for a bypass. Is duodenal switch riskier than gastric bypass, and why? Yes, it's a little riskier because it's a bigger surgery, all right? It's more complex, take more time, and obviously all these factors are going to be reflect on more time of OR, more time of anesthesia, more time of surgery, more time or dissection, more connections, and obviously it can be more bleeding and more risk of leak. Obviously we're talking between 1 and 3%, but it's a little higher, the risk in these kind of procedures. I have some middle to moderate timed heartburn. Schedule for sleep. Will my heartburn worse? Well, the heartburn, it depends a lot of factors. That's why it's very important to put all this information on the HQ. And if you have a previous endoscopy, it's very important to let us know, okay? Because sometimes, or most of the times, the heartburn or the reflux is because they overweight. The other most common is the hiatal hernia. So when we go in, the abdominal cavity is very common to see the hiatal hernia, and it's very important to repair that hiatal hernia during surgery. But if you don't have hiatal hernia, you have a severe, moderate or severe reflux, we don't recommend the sleep. The procedure, the special procedure for that kind of patients is the RMY. Okay, another question, and very frequently, is should we be concerned about being in Tijuana? No, it's like it's very secure, and you're very close to the border. You're like 5 minutes off the border, and where you will stay, it is very secure. And no, it's I think it's like the other part of the world. So no, don't worry. Okay, well, if you have another, okay, here's another. Will bypass always be necessary after sleep? Okay, because it's like the next step of on the bariatric procedures. At least I don't recommend to make a sleep, all right? Because the sleep is a restricted procedure. You already have a restricted procedure. So making more restriction will not happen. You need to make the skip to another procedure, and this will be the malabsorptive procedure, like the bypass. Talking about the RMY, the OHB, or mini bypass, duodenal switch, all other procedures that you want, okay? Can the bypass be done as the initial surgery? Yes, it can be done as initial surgery. This will depend, obviously, of what do you put on your HQ, okay, of your medical conditions. At least, I recommend to start in the patients, at least with me, with a sleep, all right? If you don't have special indications for a bypass, I always prefer to start with a sleep, all right? Because it's like more like giving the first step. Like giving the first step is only a malabsorptive, is a restricted procedure. This means that you're not going to absorb all the nutrients and on the bypass. So you're going to eat less portions. This will help you with a lot on the weight loss. And patients with bypass need to go more on your physician for visions, for blood tests, because they're not going to absorb all the nutrients. Okay, another question important here is removing the drain painful? It'll depend of each patient. Some patients a lot of the patient is more like discomfort, and this will be only for 3 to 5 seconds, no more. But it depends of how level of painful that you have. What do I do with the excess skin after surgery? Okay, well, we recommend once you have your weight loss surgery to wait 2 years, because remember, the first 18 months to 24 months is the most weight loss that you're going to lose. So if you're planning, most of the patients are planning to have a plastic surgery. So we recommend, so you can schedule your plastic surgery after 1 year. At 18 months, you can schedule your plastic surgery. Another question is, how many leak tests do you perform? What are they? Okay, we make three leak tests. The first one is during surgery. When we finish the procedure, we do the first one there. The second one is the next day at morning. We're going to give you a blue liquid. And the third will be at the X-ray. That will be the three leak tests that we perform. And on the X-ray, they're going to give you a liquid that not tastes no good, and they're going to make some X-ray, and we're going to show it to you and give it to you, obviously. Okay, another questions? Dr. Heartburn. Okay, thank you for spending time with us. It's great to hear from the doctors. My husband Norris will see you on December 11th. I will be with Dr. Guajardo the same day. All right, well, there's Dr. Rodriguez, Dr. Valenzuela, Gutierrez, I'm Dr. Montalvo, and Dr. Ceja is the other one, and Dr. Osuna. Maybe there's some error, but I think maybe it's Gutierrez, not Guajardo. All right, well, welcome. We're here waiting for you. Okay, well, do you recommend lap band to gastric sleeve? Yes, we recommend. And we, in this kind of patients who had previous lap band, we make an endoscopy to check that the lap band is on the right side and no complications, like the lap band go inside of the stomach or other conditions. First, when you go under anesthesia, we make an endoscopy, and if everything is great, we immediately start removing the lap band and perform the gastric sleeve. This will take us like other 15 to 20 minutes more of procedure. We're talking about 1 hour and a half. Mm-hmm. Yes, there's no numbers. Okay, well, what tests are done before surgery? The tests are blood tests that your hemoglobin, your leukocyte, your glucose, urine, infectious, then your blood work, the coagulation, beyond a normal range. When can I start driving my car after surgery? Well, after surgery, you can make your normal activities. Driving car once you're at home. Once you're at home, you can start driving with careful, obviously, to prevent not to hit your abdominal cavity. But you can touch, no restriction for driving. Okay, another is upon returning back to the U.S. when, if any symptoms, do you recommend going to ER? All right. Once you're at home, we always give you on the discharge paper the recommendations to go to ER. You have fever, severe abdominal pain, and if you have tachycardia, if you have some hit on your abdominal cavity, a lot of them, it's very important to go to ER for evaluation. But it's not common, but it's important to know it. And of course, to let us know, so we can contact you to know what's going on. Okay, what is the safest surgery for weight loss? All of them are safe. The percent of complications, of rate complications, is less of 1%. And the procedure is laparoscopic, so it's very safe to have bariatric surgery in the worldwide. All right, well, it was a pleasure to be with you. And so put all the information on your HQ, remember all of this, and then we stay in contact, all right? See you in the next one.